Liposuction is not a weight loss procedure and it should not be propagated as a weight loss procedure. So liposuction is a method of body contouring or body shaping. So when we remove this unwanted fat from certain areas of the body, we try to sculpt the body and provide shape to the person. Well, weight loss definitely happens, and it may happen a few months later when you start your dieting and exercise. But initially, immediately after the procedure, you will not notice any weight loss on the scale. What you will notice is that you have lost many inches and your body is in better shape than before. So the right candidate for plastic surgery is very subjective. Now, I prefer to do any of the liposuction procedures if the person is above 21 years of age and within about 65 years of age. Usually, most of the clients who are having a good exercise protocol, who are dieting and who have certain quantities of unwanted pockets of fat in certain areas of the body, they become the ideal candidate for liposuction procedure. Now, these people we know will get a very good result because they will continue with their diet and exercise even after the procedure, and that is extremely important to get the best results in liposuction. So, the candidates who have certain medical conditions like diabetes, hypertension, those who are hypothyroid do fall at a certain risk of undergoing the procedures, but if their medical conditions are well controlled, if their sugars are in control, their blood pressure is in control and their thyroid levels are normal before the procedure, they can also be fit enough to undergo this procedure. As per standardized protocol, the safety limit to do a liposuction is about 8 to 10% of the body weight. I personally try to restrict the volume of liposuction to about 5 to 6 liters in one stage. When someone is wanting to undergo multiple areas of liposuction, I advise them to undergo the procedure in stages. So if a person is wanting to contour their arms, their abdomen, their thighs, or the back region, then I ask them to split the procedure in two stages, probably 3 to 6 months apart. In one stage, I usually do the arms and the upper body, and in the second stage, I do the tummy area as well as the thighs. In case they have large volumes of fat even in the thigh and abdomen, then we do the surgery in 3 stages, probably thighs, then the abdomen and then the upper body. So I find out from my client which are the areas of the body which is most important for them, and then we start from there. And that is a good safety limit for liposuction. When we do large mega volumes of liposuction increasing 10 to 15 liters, that is when I feel liposuction becomes unsafe. So after a liposuction procedures, the most commonest symptom the person experiences is obviously pain. Now, pain is very subjective and it can vary from person to person, but most of the people I have seen have had pain usually for about 3 to 4 days, sometimes maximum up to a week or 2 weeks. But the pain is never constant and is never aggravated. The pain usually starts to reduce from the second day and gets better and better each day. A little bit of tightness, firmness in the skin, redness or bruising on the skin is very common and is expected after liposuction. It takes 2 to 3 weeks for all of this bruising and swelling to come in control. Generally, the person starts to see the shape on their body by the 3rd or 4th week following the procedure. When it comes to getting back to your daily routine, usually by the 4th or 5th day after the procedure, we insist our clients to get back to their daily routine, their work activities, or even go to their office. And we insist all our patients must go for a 30 to 40 minute walk every day after the 4th day of the procedure. Liposuction is predominantly almost like a scarless procedure. So the only scars which remain after liposuction are these tiny 2 millimeter cuts which are made at various points, usually at the lower panty line area or at the lower part of the back, sometimes 1 or 2 cuts inside the belly button, and these scars are hardly visible, and after a few months they generally look like probably like a brown spot. So yes, there are not many scars in liposuction. It is one of the most scarless procedures.